We actually have increasingly good news to report about what's happening with coronavirus vaccination in the United States and in some other countries. But with most of our audience in the U.S., we're going to look at U.S. data today. And you would think everybody would be thrilled about this, but there's actually some people who are furious at the number of vaccinations happening and the number of vaccinations that will soon be taking place. But we'll get to that a little bit later in the show. You might remember that last weekend, not this past weekend where we changed the clocks, but last weekend, we had a record 7 million or so vaccinations in 3 days. That was the best 3-day period to date. We blew that out of the water this past weekend with 8.8 million vaccines injected on Friday, Saturday, and Sunday, by far a new record. Now, this does include what is essentially a massive dump of vaccine data on Saturday. It made it look like there were 4.5 million vaccinations done just on that day. In reality, there was a change to the methodological data. And in reality, that 4.5 million would be kind of spread out over a few days, which is why we're saying 8.8 million vaccines over 3 days, now pushing us to an average of about 2.4 million vaccines per day over the last week. I think we're on the way to 2.5 million a day. I think we're on the way to 3 million a day. The question is more, will we get to 3.5, or how much can we really do? But this is looking increasingly good. Right now, the states with the highest percentage of people fully vaccinated are Alaska at 18%, New Mexico at 17%, South Dakota and West Virginia at 15%. And then you've got a bunch of states at 14%, a bunch more at 13%. The states doing the worst with vaccination as a percentage of the population are Utah at only 8%, followed by Washington, D.C., not a state, I know, but it's still on our list. Tennessee, California, Georgia, Texas, and then you've got a few states at 10%. Now, the reality is that with Alaska and New Mexico as outliers at the very top, the states doing great are at 13 to 15, and the states doing poorly are at 8 to 11. So, like, the range is relatively tight, and it has to do with a number of different factors, including distribution of doses, rural versus urban nature of each state. And over time, these numbers are going to go up, and they're going to go up more quickly. Now, Dr. Anthony Fauci suggested over the weekend on CNN, keep vaccinating as quickly as possible, but keep measures in place, because some of the things that are starting to happen, including in Florida and other spring break destinations, are not quite so good. But let's take a look.
The best way that we can avoid any threat from variants is do two things: get as many people vaccinated as quickly as we possibly can, and to continue with the public health measures until we get this broad umbrella of protection over society that the level of infection is very low. You know, there's a tenet in virology that's so true, Jake, and that is viruses don't mutate unless they replicate. And replication means it's spreading around in the community. If you can blunt that, you'll be blunting the evolution of mutants for sure.
So, Dr. Fauci, of course, absolutely correct. And we'll talk about the spring break stuff a little bit in a moment. What new information do we have about the impact of vaccines? Well, we know that so far, coronavirus cases have fallen 80% among U.S. nursing home staff and residents. They were of the first groups of people to be vaccinated. That's very good. We know we're heading to full adult vaccine eligibility across the United States. Everyone 18 plus will be eligible for a vaccine per Joe Biden's announcement on Thursday night, on May 1st or sooner. Some states ready to move even sooner. That's just 6 weeks away at the latest. That's fantastic. We know, thanks to really detailed Israeli data, that of the people recently hospitalized there, only 8% had been vaccinated. 74% of those hospitalized had no vaccine. And the remainder, about 18%, were between dose 1 and 2, not yet at full vaccine power. That is reassuring data. But we also know that tons of people are going nuts, and even absent being vaccinated, are starting to ignore all safety measures. Florida, for example, becoming an absolutely out of control spring break situation with maskless people all over the place as if nothing is going on. Now, we shouldn't do this. This is a major problem. My guess is that if you start having young people go nuts, but continue vaccinating those most at risk, you'll still get a ton of cases, but you should see fewer hospitalizations and deaths because the people going bonkers on South Beach are primarily younger folks who will not statistically get serious cases. Some will and some will die, though. But the most moral, the most logical thing to do would be let's keep up the guidelines for just a little bit longer because we are starting to get there. Case declines have slowed down a bit. Death declines continue to go relatively quickly, and we'll have updated numbers about that tomorrow. But what we have to talk about next is you would think there's no way to spin more vaccinations as anything other than a fantastic thing. But there are right-wingers really angry at how many people are now getting vaccinated under the new protocol of the Biden administration. And we're going to talk about that next. If you are anything like me, you probably aren't thrilled with the idea of going into a doctor's office right now. And thankfully, there's a practical and affordable way to take control of your health and get personalized care from the comfort of your home. It's a service called SteadyMD. They're one of our sponsors. You take a quiz, you get matched with a licensed primary care physician who understands your health needs. You have a 1-hour video call with your new doctor. You establish a meaningful relationship with them. And after that, your doctor is available to you anytime by text, phone, or video chat. This is not a random doctor on call. Each doctor at SteadyMD has a limited number of patients, so they actually have time to listen to you. You get the personal attention that you deserve. They can do almost everything an in-person doctor can do: perform medical evaluations, talk to you about health concerns, send prescriptions to your home or local pharmacy, and anything they can't do online, they'll quickly set you up with an in-person provider to do, things like blood tests, as an example. You don't need insurance. It's only $99 a month with no other fees or copays. There are so many practical advantages to using SteadyMD for primary care, and it's also so much more affordable. Go to steadymd.com/Pakman to take the free quiz, see which doctor is right for you. I took their quiz. They matched me with a doctor who specializes in my particular health needs and situation. The doctor they gave me is a really perfect fit for me and my medical needs. There's no risk, no commitment to get started. Just click the link right underneath this video.